Hello, welcome. My name is Christian Morgan. I'm a family support worker at the CDI EarlyON Child and Family Centers, and we're going to be doing a presentation on the 9-month Looksee Checklist. Look list.
Hi, everyone. My name is Glenda Diaz. I work at the same center, and I'm also a family support worker.
Hi, everyone. My name is Diane, and I'm the office administrator, and I also work at the same center. So today, as Christian mentioned, we'll be looking at the 9-month Looksee Checklist. And just to give you a background on what it is, the Looksee Checklist is a simple, easy to use developmental tool designed to help monitor a child's development from 1 month to 6 years of age, featuring a short yes or no questions about the child's abilities. The Looksee Checklist, formerly called the Nipissing Checklist, was created in 1993 by a Canadian nonprofit organization made up of early childhood specialists. In 25 years since, it has been translated into over 10 languages, and it has helped thousands of children worldwide through initiatives with organizations like the Ontario Ministry of Children, Community and Social Services, and World Vision.
Awesome. So we're going to be going through this page by page. And so we're just to get started, when you're first getting into the checklist, the first thing you want to do is look for the appropriate checklist, right? It's done by age, and essentially you just find, well, you look at the age of your child and you find the one that's closest to the age of your child, and you round down. So if your child is over the age of 4 months, but not quite 6 months, or I guess over the age of 6 months, not quite 9 months, you go to the one below, and that's where you start. Now, if your child was premature, you can see there's a lookseechecklist.com/premature. You can look and see how to adjust for that difference. So yeah, then you just go through, you answer the questions to the best of your ability. We're going to be going through the long form one, the one with pictures and the extra details. And then if you see no on any of the questions, don't get scared or anything like that. We're just looking at a spectrum of abilities, and we're using this to track how far along we're going. So we're not everyone is lined up at the same exact timing for all these developmental milestones. So, but it is a good idea to follow up with a professional if you do answer no on things. So check with your doctor or pediatrician or whatnot.
Then also at the end, we're going to be giving, there's the checklist, the short checklist has suggestions on how you can develop the different milestones. So then we're going to be covering these in a little bit more detail. There's emotional, fine motor, gross motor, social, self-help, communication, learning, and thinking. So I'm just going to switch over to, this is the long form that we're going to be looking at. You can also you can download them. They're completely free. You just have to register your email at lookseechecklist.com/EN is English. They do have them available in different languages as well.
Right, so we're going to go through the developmental markers, and we'll just explain them. We're just going to read off the page, but you'll get the idea. So there's all these different developmental markers, and depending on the age, we don't necessarily cover every single one of them. I think we are on this one, maybe not the self-help. So starting with emotional, so these items look at the child's ability to discover self and the relationship of self with others. Also included in this area is the development of a sense of safety and security.
With fine motor, these items look at the child's ability to develop strength, stability, and control of the arms and hands for functional movement. The development of hand-eye coordination, visual motor integration, and oral motor coordination for feeding and speech are also included in this area.
Next, we'll be looking at the gross motor. These items look at the child's ability to develop balance, coordination, strength, stability, and body awareness through movement.
Social items. So these items look at the child's ability to develop turn-taking, sharing, cooperation, and empathy through interactions, games, and imaginative play. Attachment and development of joint attention are also included in this area.
Then with regards to self-help, these items look at the child's ability to develop responsibility for daily activities and move towards independence. You might not necessarily be looking at these ones yet, but we're going to work on them as they get older.
Communication, these items look at the child's ability to develop language, comprehension, and language expression through sounds, gestures, words, and word combinations. Receptive language, expressive language, articulation, fluency, and conversation are also included in this area.
We have learning and thinking. I think in the past they used to call it cognitive, but these items look at the child's ability to explore, increase knowledge, and improve memory, reasoning, and perception by acting upon objects in the environment through the use of touch, smell, taste, hearing, and vision. They demonstrate an awareness of self and others, motivation, and attention to task.
With regards to vision and hearing, keep in mind that visual and hearing acuity can impact the child's ability to perform successfully on many items. If there are any concerns, make sure that an appropriate referral is made to an eye care and/or hearing professional. I'm just going to make this a little smaller.
So by 9 months of age, does your child look for a hidden toy? Some further questions are, does your baby look for a toy after you hide it under a cloth or paper? When you put a blanket over your head, does your baby pull it away to see you?
They're looking for object permanence, like if that has developed. Yeah. So by 9 months of age, does your child imitate facial expressions? So when you smile, does your baby smile back? When you open your mouth wide, does your baby do the same? When you stick out your tongue, does they?
And with this one too, it's important to remember to give them time. They don't do it immediately. And we sometimes think, oh, they're not doing this. But if you count 10 seconds, and it's actually, if you go like 1,000, 2, 1,000, and you get to 10 seconds, that's how long it takes their brain to process the information. So for this one, we try to remind everyone, it's important to wait.
Yeah, give them time.
Yep. Do they turn to look for a source of sound? If you make a noise, does your baby turn to look at you? Or if something startles them, do they look of where that sound came from?
By 9 months of age, does your child understand short instructions? Wave bye-bye, no, don't touch. Some further questions. Does your baby stop briefly what they are doing when you say no? When you say wave bye-bye, does your baby wave?
And we know a lot of people don't like to use the word no. They like to save it for when it's a real emergency. You know, other phrases that you can use are like, that's not for babies. So trying to think or letting them know what they can do. Your feet go on the ground, but keeping it nice and short.
So by 9 months, does your baby babble a series of different sounds? Such as ba 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 da 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 da. Ga 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 ga. What sounds does your baby make? Does your baby make different sounds?
And this too, if your child speaks a different language, depending on the sounds that they're hearing, it will be the sounds that they're making. So it doesn't necessarily have to be these sounds, as long as they're making different sounds.
Just because they're going da 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 da, they're not necessarily talking about da da.
Yeah, if it's
Sometimes
not
they
a
make
word,
up for it.
yeah, if it's not a word that they use in their language, it could not be, but it could also be.
Glenda.
Oh, sorry. By 9 months of age, does your child make sounds or gestures to get attention or help? Does your baby make different sounds to get your attention? How do you know when your baby needs help? Does your baby put their arms out to be picked up? And this can look really different. And we remind parents, you are an expert in your child. So you know the sound or the gesture that they make for something. It might mean something completely different to somebody else, but you know what they want.
By 9 months of age, does your child sit without support for a few minutes? For the questions, does your baby stay in a seated position for a few minutes when you let go? Can your baby sit alone on the floor?
By 9 months, does your child attempt to move by crawling or bum shuffling or pivoting on tummy? Can your baby move a short distance across the floor without help? Does your baby move towards a toy that is out of reach?
And we've all seen very creative ways that children move.
Yeah. So many different kinds of scooching and
Yeah.
and your baby might move differently based on your flooring too, which is kind of interesting.
Mm-hmm. By 9 months of age, does your child stand with support when helped into a standing position? Does your baby stand with your help? Can your baby stand while holding on to furniture?
By 9 months of age, does your child pass an object from one hand to the other? Does your baby pick up a toy and then put it in the other hand?
By 9 months of age, does your child pick up small items using thumb and first finger? So that's, I guess, your index, right? So like looking at crumbs or cereal or rice. And just to point something out, those are not olives that the baby is holding. I'm pretty sure those are Cheerios. Further questions, does your baby pick up cereal with their finger and thumb? That's usually the starting trial thing that they like to test that out with.
You'll also notice a lot of babies at this age, they will find the smallest crumbs
Yeah.
on your floors and really
Carpet
inspect
fiber.
it or try to eat it.
Yeah. Digging through that carpet fiber.
Yes. By 9 months of age, does your child bang two objects together? Does your baby bang two toys together, or do they try clapping? When holding a block in each hand, does your baby clap them together? Right? Or if they're not holding anything, you'll see a lot of clapping at this age as well.
By 9 months of age, does your child play games with you? Nose touching, peekaboo? What games do you play with your baby? When you play games with your baby, how does your baby respond?
So Christian was saying earlier, the idea of object permanence, peekaboo, we always encourage, even before 9 months. It teaches them the idea of just that we can go away and come back for them.
It's good to practice. By 9 months of age, does your child fuss or cry if familiar caregiver looks or behaves differently if a familiar caregiver? So what does your baby do if you change the way you look? What would you or baby do if you acted upset?
So we see this a
they're
lot
very
if babies.
attuned to your emotions.
Yeah, and also if you get glasses, or sometimes like if somebody has grown a beard, you just look different. They're not sure, they're not used to seeing you a certain way, they could react differently to you.
I got an anecdote for that. That one time I was doing supply work at a childcare center, right? And I was on for 2 weeks. I was covering a vacation, and for the first week, I was wearing my contact lenses, and then ragweed season hit. So I couldn't wear contact lenses. I had to put my glasses on, and I walked into the door. No, I didn't walk in. I walked through the door on the Monday, and every baby was upset. Every single one of them. I think maybe one baby was kind of okay with me, but I had to take my glasses off and just be half blind for most of the day.
Oh, man.
Oh boy. Yeah, they notice
They're
these
very
things.
sensitive.
Yeah. Do they reach to be picked up and held? How does your baby show you they want to be picked up? Does your baby put their arms out to be picked up? And it could look different, like we were saying before with the other one. They might make different gestures, and you know that's the gesture that they make for you to pick them up. So I'm just going to switch back to the other one. So these are the questions that we just went through, except that they had extra, that's the long version, and they had extra follow-up questions. We're just gonna go through these ones. They help you, they give you some tips on how you can continue to support their development.
So I'll start, right?
Mhm.
So you'll notice on the pictures, it's hard for me to see with the angle of my screen here, but there's little icons down on the bottom right. And so that tells you kind of the area that you're working on, the developmental area you're working on with your baby with these tips, right? So we're looking at the emotional one to start. So hug and cuddle me often throughout the day. Tell me how wonderful I am. Continue to talk to me about my world. Make me feel safe and secure by holding me, singing, and having quiet time with me. It is very common for me to prefer to be held by people I know well.
So the next one is, I like things that I can hold and bang together, such as plastic bottles, pots, pans, and blocks. Give me a spoon or a toy hammer and show me how to tap the pot lid, plastic container, block, or floor. Help me practice using my fingers. Give me chances to feed myself with finger foods like crackers and dry cereal. Place them in a small bowl and encourage me to pick them out. Yeah. I could choke, so stay close by.
When I am on the floor, I can move in many different ways. Put toys out of my reach and encourage me to move towards them. Let's climb, place pillows and cushions on the floor. Put one of my favorite toys on top of the pillow and I may try to get it. When you are lying on the floor, let me climb over you. When I am in my crib or near the couch, I like to try to pull myself to stand. Remember, I am not too steady, so stay close by.
Got some more gross motor. When I am sitting alone, encourage me to reach up and to the side for toys. I like to practice getting in and out of a sitting position by myself. And then we've got, I like to eat with you. Let me sit with you for family meals. So that's the social one that we're working on there.
Let me imitate your actions and facial expressions. Play with me face to face and wait for me to respond. Repeat actions several times. Once I can do it, let me lead and you imitate. I like books with short sentences and simple pictures. Let me hold the book and turn the pages. Name the pictures. Don't be afraid to read the same book over and over again. I like the repetition. Read animal books and make the animal sounds too. Cut out pictures from magazines and use photos to make me a book of my own. And you'll notice a lot of the times at this age, they'll want to eat the book a lot. And I know that a lot of parents don't necessarily like that, but it's important to remember that they're developing all of the muscles that they're going to use for speech.
You can
Constant
teach
vigilance.
Yes.
You can teach me how to follow short instructions by showing me. Help me wave bye-bye, blow kisses, and clap hands. Encourage me to drop my toys into large containers such as dishpans, shoe boxes, or plastic buckets. Show me how to dump them out and put them back in again.
And then this last one is kind of like a safety tip. So I'm getting into everything. Time to child-proof my home. So a good way to do that too is to get down to the baby's level, like on the floor, and look around at that vantage point, and you can maybe get a better idea of where your baby is going to want to go and get into the wires and the doors and all that stuff. So yeah.
Yeah, that's all the information we have for today. So thank you for joining us. If you do have any questions, maybe we can have everyone, you can email us at
cdiearlyon@childdevelop.ca, or you can give us a call at 416-762-3700.
and we'd be happy to answer any questions about this checklist or any other developmental questions you might have. Thanks for joining us.
Thank you. Bye.
Bye.